Cariprazine is a new second-generation antipsychotic drug that's in its late stages of clinical development. Trials of the drug have exhibited positive results for the treatment of schizophrenia, however it is still yet to receive FDA approval. Before we discuss why, let's take a look at schizophrenia and its treatments. Schizophrenia is a severe psychiatric disorder characterized by positive and negative symptoms. The positive symptoms, or behavioral excesses, include delusions, hallucinations, and disorganized thoughts or behavior. The negative symptoms, behavioral deficits, can show as reductions in emotion, poverty of speech, lack of motivation or goal-orientated behavior, and loss of social functioning. Although there is no clear pathogenesis for the disorder, there are several theories. Drug therapy aims to address excess dopamine activity or reduce glutamate activity in the brain. Conventional treatments for schizophrenia were originally based on a group of first-generation antipsychotics that targeted the dopaminergic pathway, such as chlorpromazine and haloperidol. However, advances in this area have seen the development of a group of second-generation drugs with higher tolerability and fewer side effects. The examples shown here are clozapine and aripiprazole. Despite these advances, 20 to 60% of patients still do not receive the desired outcome from current treatments. The development of new drugs, such as cariprazine, aim to address this issue. So, how does cariprazine work? There are two main sites of action, however other receptors may also be non-specifically affected. Cariprazine exhibits partial antagonistic behaviour at the dopamine receptor. Its lower affinity for the D2/D3 receptor allows it to act as either an agonist or an antagonist depending on the levels of endogenous dopamine in the brain. In the presence of excess dopamine, the drug reduces receptor activation, thus reducing the severity of most positive schizophrenic symptoms. The drug has a similar effect at the serotonin 1A receptor, which clinical trials have suggested could be responsible for the drug's unique ability to treat some of the negative symptoms. At the serotonin 2B and histamine 1 receptors, the drug acts as an antagonist. The effect of this action is largely unknown, however, most likely linked to the unwanted side effects of the drug. Cariprazine is rapidly absorbed when administered orally and reaches peak plasma concentrations within about 3 to 4 hours. In the body, it splits into two active metabolites, desmethylcariprazine and di-desmethylcariprazine, both of which exhibit excellent blood-brain barrier penetration. The drug is degraded in the liver by the 3A4 variant of the cytochrome P50 enzyme, and it's excreted via the kidneys. There are several significant differences between cariprazine and current schizophrenic drugs. Clinical studies have shown cariprazine to reduce the severity of both positive and negative symptoms compared to conventional drugs that only treat positive symptoms. Unlike other drugs that primarily block D2 receptors, cariprazine has a stronger preference for D3. While both are administered orally, there is a steep difference in half-life. Whereas traditional antipsychotics have a half-life of 15 to 30 hours, cariprazine's half-life is increased to 2 to 5 days, longer for its metabolites. The implications of this could mean longer duration between dosages and therefore greater overall medication adherence. The biggest advantage over traditional drugs is clinical data that suggests cariprazine may exhibit less extrapyramidal symptoms, reduced prolactin secretion, no cardiovascular events such as lengthening of the QT interval, little metabolic abnormalities, and little to no weight gain. Despite the overall reduction in side effects from current treatments, some extrapyramidal symptoms, particularly akinesia or restlessness in the legs and feet, are still present. Other commonly experienced effects from the drug include dizziness, nausea and constipation, and insomnia or sedation. It's hard to see why, with so many promising improvements on traditional treatments, the FDA is still yet to approve this drug. In short, lack of sufficient clinical data. Much of the clinical research conducted in this area is short-term, biased, and there is little comparison between drugs. Another point the FDA has to consider is while most extrapyramidal symptoms are reduced, trials of the drug have actually shown an increase in akinesia. To add to the lack of data, developers of the drug have yet to publish efficacious dosage data or define an appropriate therapeutic range. All of these issues have led the FDA to question the overall safety of the drug, and while cariprazine may present an exciting new avenue for antipsychotics in the future, at this stage it seems that approval will just have to wait.